Improving people's health with wearable technologies. That's the goal of mHealth. We are visiting the University of Kaiserslautern and the wearHEALTH workgroup, which develops these types of mobile health services.
Wir sind eine interdisziplinäre Nachwuchsforschergruppe.
We are an interdisciplinary group of junior researchers and are funded by the BMBF. We focus on developing user-adapted and reliable health systems based on mobile and wearable technologies. Our goal is to use mobile technologies such as smartphones, tablets and wearable sensors, also called wearables, in medical settings, both in a preventive context and in rehabilitation.
Oder einzusetzen, sowohl im präventiven Kontext als auch in der Rehabilitation. Wir entwickeln personalisierbare und motivierbare.
We develop customizable, motivating user interfaces and combine them with a motion analysis system to support self-training. One of the issues we try to determine is how motivating playful elements are and how they can be expediently used in this setting. What type of feedback does the user need to effectively support the exercises? And how can we give feedback over an extended period to encourage sustainable health-conscious behavior? Due to demographic changes, there is an increasing number of chronic diseases and patients in need of care or rehabilitation. At the same time, there is a healthcare staff shortage. That's why it's crucial to develop new concepts. Digital technologies have great potential in this area and can play an important role at this juncture.
Es ist notwendig, sich neue Konzepte zu überlegen und neue Konzepte zu entwickeln, und gleichzeitig bieten digitale Technologien ein sehr großes Potenzial und können also einen sehr großen Stellenwert haben.
The AG wearHEALTH has created a customizable, motivating user interface with the game jumpBALL. It's a so-called exergame.
Exergames sind eine Kombination aus
The term exergame is a combination of the terms exercise and game. It refers to physical activity with a gaming component. jumpBALL is a game that was developed to boost thrombosis prevention. Thrombosis prophylaxis is typically made up of 3 pillars: drug treatment consisting of heparin or thrombosis injections, mechanical methods such as compression stockings for example, and general basic measures. This also includes exercises with a muscle pump, also called venous foot pump for example. Our game is controlled by using this venous foot pump or muscle pump.
Muskelvenenpumpe oder auch Fußwippe genannte Übung. Und indem man diese Fußwippe oder Muskelvenenpumpe durchführt, steuert man unser Spiel.
The game development involves many disciplines, including computer science, mathematics, kinesiology, psychology and medicine.
Entwickelt haben wir dieses Spiel vor dem Hintergrund.
We developed this game primarily with older patients in mind who are unable to immediately move due to complications at the hospital after hip or knee replacement surgery, for example. jumpBALL is based on the muscle pump system. It is a tool to stimulate blood flow within the veins. When the test subject activates the muscle pump by flexing and extending his or her toes, the calf muscles are contracted, which promotes blood circulation.
Insbesondere innenliegenden Venen zu fördern. Und indem der Proband die Muskelvenenpumpe macht, das heißt die Fußspitzen anzieht und die Fußspitzen wegstreckt, wird die Wadenmuskulatur zusammengezogen und der Blutfluss wird dadurch einfach gefördert.
jumpBALL has already been tested for its motivating effect when performing muscle pump exercises in a study of 40 test subjects.
Im Rahmen der Benutzerstudie konnten wir
Our user study revealed that our game was able to increase motivation in the test subjects to perform the muscle pump motion. This is a relatively boring and monotonous exercise over time, but thanks to the game, we were able to motivate the test subjects to perform approximately 415 repetitions on average, while the test subjects in the control group only performed 120 repetitions. At the same time, the test subjects in the gamer group, meaning those who played our jumpBALL game, performed the exercise reps 2.5 times longer than the control group.
so lange überhaupt die Übung gemacht im Vergleich zu der Kontrollgruppe.
In the future, the work group also wants to study whether exergames can potentially boost other health measures in addition to prevention purposes.
Wir wollen an der Stelle so weitermachen.
In the future, we not only want to study the application of exergames for thrombosis prevention, but would also like to utilize them in rehabilitation settings. This is also an area where repetitive exercises can quickly become monotonous. Exergames are a suitable tool to motivate people and ensure patient adherence during rehabilitation.
Adäquates Mittel haben, um den Patienten einfach zu motivieren und die Therapietreue auch zu gewährleisten über den Rehabilitationsprozess.